Hello, everyone. I am Alderman Will Stewart, and I'm here today with Victoria Adewumi, Community Liaison with the Manchester Health Department. And today we're going to be talking about the recently published Greater Manchester Community Health Needs Assessment. Welcome, Victoria.
Thank you so much for having me. Well, I also want to give you 10 points as the only person who pronounces my last name correctly. So we just have to begin with some affirmations there. Great job.
Well, I know I've mispronounced it before, so I was practicing beforehand, so I apologize for past
Excellent.
indiscretions, but I try to learn from my mistakes.
Excellent job. Excellent job.
Well, Victoria, let's jump right in. So, released just last month, the 2022 Greater Manchester Community Health Needs Assessment. That's a mouthful, but it's a treasure trove of data about our community. And I'm wondering, just to kick things off, if you can just kind of give us an overview of what it is and what kind of data does it include and why was it produced, and ultimately, why is it important?
I would be happy to. Those are fantastic questions. So just as a general overview, if we take a step back, health needs assessments are conducted by communities all over the state and country, and they usually have two main purposes. So the first is to provide a roadmap for where communities should focus resources and attention. It helps really prioritize and guide the development of health and social service interventions, especially when there are limits to available resources. I always say you can't change what you don't measure. So a community needs assessment, or China is another sort of acronym for it, provides that community level measurement that ensures we are maximizing our influence to make Manchester the healthiest community in the entire state. So that's the first purpose. The second purpose is that we are actually required by state law and our charitable partners to conduct a needs assessment on a pretty regular basis, so usually every 3 years. This document really allows Manchester to receive certain dollars that we as the health department and also our hospital partners such as Catholic Medical Center, Dartmouth Health, and Elliott Health System are able to then invest back into the community, really in the areas that need it most.
Well, that's great. And, I think, our goal is always to have kind of data-driven decision making to make sure that, the money, those scarce resources that we have are spent wisely. And we need actual data to do that, not hunches or, anecdotes or observations. Yeah.
Thank you.
Real hard data.
Exactly. I couldn't agree more.
So, with that, and I appreciate, how you said this can help us kind of prioritize, where we want to deploy those resources. I'm curious, what are some of the kind of the high level takeaways that came out of this most recent assessment?
Well, there are so many. There are so many takeaways. So I won't touch on all of them, but I'll try to do my best to give that bird's eye view. And just a quick public health 101 primer for all of us. We know that the environments that people live in are as much, if not more, important to your overall health status than your own health behaviors or the medical care you receive. Your environment and other, we call them social determinants of health, account for almost 60% of your overall health status. So that being said, there is quite a lot that we as a city, I think, have to be really proud of, right? We are a strong, diverse, resilient community, and we really have some amazing interventions that are already on the ground today. Now, at the same time, we as a city understand that there are some real opportunities to address present and historic concerns in ways that really elevate everyone. And so some of those areas include improving educational outcomes for our young people. So specifically increasing preschool and kindergarten enrollment, reading and math proficiency, and high school completion. We also, and this will come as a surprise to none of your viewers, we are really hyper-focused on reducing and preventing substance misuse. We are seeing as a city a real increase in overdoses, substance-related emergency room visits, and the related consequences for our neighbors experiencing homelessness, right? We see that, and we know that we need targeted, immediate attention in those areas. Another key area for us to work in is improving access to preventative care, healthy foods, and affordable housing, right? Those critical basic needs. And we know that not everyone in our community right now today has the same level of access to these critical health needs. And we're really working every day to change that. And then finally, what I'll mention is really preventing and addressing trauma in our neighborhoods. And that means specifically reducing the impacts that poverty and violence are having in our communities. So if we were to wrap up the document in a nutshell, those would be our sort of high level themes.
Well, I appreciate it. Those are, obviously very, all very serious, aspects, and, a big part of, of any community's life. And, some that, that grab the headlines, like, opioids and drug use and, sometimes gun violence and things like that. Maybe other things that are a little bit quieter that have effects that, that maybe a lot of people just don't think about or don't even, recognize as having those types of effects. I'm curious, with regard to of all the data collected and all the kind of metrics that were analyzed, what, if anything, surprised you and your colleagues in this most recent assessment?
So, Will, if I am completely honest with you, if you compared the data from the last needs assessment that happened in 2019 to this current one, you will see many of the same themes. So things like poverty, housing, substance use, and education, like you just mentioned, they're a little bit quieter. They're sort of under the radar sometimes. But for us and in our needs assessments, they've been priority areas for many, many years. And at the same time, I have to give a shout out that we are blessed in Manchester to have a really robust social service network doing incredible work in all of these areas, even as we're talking about the needs assessment, we clearly have room and opportunities for us to continue to improve. And really, I mean, not to continue talking about it, but to be honest with your viewers, right. COVID-19 has really created new and unmet burdens in all of these areas. And so for us, it is more important than ever to have this kind of data to guide the way forward. And just one other thing really critical to the development of this document, I have to say, was our work to center the voices of residents who are truly, truly the experts in what's happening in their neighborhoods, and ensuring that their input is valued as highly as whatever data is collected, right? And it was not surprising necessarily, but it was really affirming that when we had our community conversations, when we talked to residents, the same priorities that showed up in the data were the same priorities they identified. It felt really true to their experiences and their perspectives. So, for example, residents in Manchester ranked housing as the #1 health priority in Manchester, followed by trauma concerns and substance misuse. And so for us, it really feels like we're building this alignment across sectors with residents. And we know that as we start building and developing interventions in these areas, we're not just focusing on the right things, but we also know we have the community buy-in already to make sure our interventions are successful.
No, that's great to hear. And, it doesn't surprise me, that, people's experiences and, what they told you matches up with the data, because, I mean, who's more of an expert, about a neighborhood than the people who live in the neighborhood 24/7?
Come on, exactly. Thank you.
So, I appreciate how you said that, kind of what was gleaned from this report will be used to kind of, I believe your words were, you kind of, guide the way, for us,
Yeah.
With interventions and other such things. And, I'm glad to hear that, because, collecting data for data's sake, I know isn't the goal, but, so can you talk a little bit about how exactly this data, can and will be used to improve, health and other outcomes here in the city?
Absolutely. And exactly to your point, this for us is a roadmap, it's a guidebook that really informs future planning. So within the report, we actually have already identified some next steps towards this vision we have of every person in Manchester having their very best chance to thrive. And some of those next steps are continuing, frankly, to invest and bolster initiatives in Manchester that are already working in all of these areas. Things like the ACERT Rapid Response Team, Project Launch, other initiatives that are already doing incredible work across these domains. And at the same time, supporting residents to identify the community-based solutions that they know work best in their unique context, taking the incredible community knowledge that we know that we have they have and just amplifying it and making it really sort of our guiding light as we think about how we can better help and improve the health of residents across Manchester. And another important step for this specific data is to use it to update our community health improvement plan. So if you think of the community needs assessment as sort of step one, the community health improvement plan is usually the step two, where you strategize with partners across the community to identify, if we are saying these are specific needs, what are some solutions that we can start thinking about critically to address them. So having this data is literally being able to sort of hold up and say to our community, nonprofit, and other stakeholders, this is the need. Help us mobilize a targeted plan to address it.
And when do you expect that plan to be published?
Great questions. Great questions. Well, we're doing that work this year. So unfortunately, I don't have an ETA, but if I had my druthers, the ideal is that this time, Christmas-ish, holiday time, 2023, you all will be able to read your neighborhood health improvement plan to some light reading before the holidays.
Well, we'll have to circle back maybe then and discuss that plan at that time.
I would love to.
So, Victoria, definitely appreciate you kind of giving us an overview of this, very complex document. I'm curious, is this available on the health department's website? Where can people kind of get a look at this if they want to really delve in?
And we would really, really encourage folks to please, please, please read the document. It does not exist to just take up space, on a shelf or online. We really want folks to engage with the content. We also worked really hard with our partners to make sure this information is being presented in ways that are as accessible as possible. And so we hope that folks really feel like they can get their arms around it and really delve deep into the content in there. So to answer your question, it is absolutely on the health department website. It also is on sort of the city landing page as well. And I'm more than happy to send a specific link to you, Will, if you want to blast it out, spread the word, and make sure folks are able to read the community health needs assessment for themselves.
Yeah, no, I will absolutely throw the link, on social media and certainly in the description on YouTube where this video will be housed. So, kind of in closing, I'm curious to know, Victoria, if you might have any asks for those watching the video today, or city residents in general. Is there anything we as residents can be doing to help you and your colleagues in your work?
So that is such a powerful question. So first, I just want to say thank you so much for helping us get the word out. There are literally thousands of hours collectively of investment in this document. So on behalf of my colleagues, I just want to say thank you and really encourage folks to please, please, please read the document. We really believe that as a city, positive change happens when we're all pulling together, and that we have a roadmap to be able to do that. And so this is not a perfect document, but it helps us start building that plan. And so to have as many people receiving the information, getting on board with that plan as possible helps us, and we believe helps Manchester. So again, would love folks to please engage with the document and read it, ask us questions, respond to some of the prompts that are in there, and really make sure that they are feeling ownership of the content that's in the community health needs assessment.
Well, Victoria, thank you so much again for joining us here today and giving us a very brief introduction and a little peek into this very comprehensive report, which is, I have a copy of it sitting on my desk. It is very readable. Kudos to you and your team for putting it together, and it will be sure and share it out for everyone to get a look at as well.
It is my pleasure. Thank you so much for having me, Will.